Hi there, and welcome to Ubuntu, Hearing, Communication, Language, and Connection, the podcast where we explore the power of connection, shared experience, and overcoming challenges related to hearing loss. I'm Bianka, a mom navigating life with my son Oliver, or Ollie, who uses bilateral cochlear implants. And I'm also the founder of Ollie Pop Toy Shop, where I create tools and resources for listening and language development.
And I'm Karen McIver-Lex, and I'm an audiologist and LSLS certified auditory verbal therapist and co-founder of Thrive Together, a private practice in Toronto, Canada, where I work with individuals of all ages with hearing loss and their families. I bring both professional expertise and personal experience as a cochlear implant and hearing aid user myself.
We're so excited to have you here. The space is for honest conversation where we share insights, stories, and our journeys with hearing, communication, and connection.
We're not here to offer expert advice or tell you how to do things. Instead, we're sharing our experiences, our challenges, joys, and the many ways we navigate the world.
So whether you're a parent, a professional, someone with hearing loss, or perhaps know someone with hearing loss, or just curious, you're welcome here.
So pull up a chair and join us because we are.
So welcome to our third Ubuntu episode. We are really excited to be here, and we are just going to continue the conversation from where we left off last time. So, Karen, last time we really chatted about both of our stories leading up to Ollie's implantation and your own implantation, and also the different feelings that I experienced as parent, but also as Ollie, where I said he was so relaxed after having access to sound, and you shared beautifully how you felt the same way, especially seeing life with color, which is such a beautiful metaphor to explain access to sound.
It's amazing how this body language is so important to observe. I was looking for pictures of me in therapy with children, and because I was trying to find a picture for a publication and for an article that is being released in a journal, and I was looking at videos, video footage, and I was watching how I'm watching everything that the child is doing, and I'm playing with them, and I'm just looking at the body language in wonder. And I love that expression on my face because it truly is. It's wonder at how the body responds to really, really good sensory input, like being able to hear so well. Yeah. So it's a great
And this
reminder for me as well.
we're at some point, and we'll have a chat, I'm sure enough. But this whole idea that cochlear implantation or even hearing aids, it's not a cure. At the end of the day, there's all this work that goes into it as well, which is this holistic way of looking at it. So yes, absolutely, the body language of the person using this technology has to be taken into account, because they could be doing well, I'm assuming, but be in pain if it's not working for them. Yeah.
Yeah. I love that we talked about that physical aspect. And Bianca, as a kinesiologist, you bring so much into this conversation about how the body needs to be regulated. How do you get the body regulated? And um I just body language is so important. And I think we professionals can miss those cues. And that's what I try to talk about with the parents all the time. Do you see that? Do you see that?
Yes.
Look at that. Did you see that? Did you see that? Like, what? What?
Exactly.
And sometimes it can be just a child laying down on the floor. And I'm like, oh my goodness. Did you see that? Look, do you know what your baby's doing there? And they're like lying on the floor. So I don't know. And I'm like, he's resetting his auditory system. He's trying to ground himself. He's overwhelmed, and he's trying to get himself a little less overwhelmed and a little bit.
Exactly. A little less dysregulated.
That's right. That's right.
So,
So, yeah.
and I think that's such a good way, a lead on into, we spoke last time about going into the operation and that little, I want to say ritual that you did for yourself, um,
Yeah.
saying goodbye to your ear. And yeah, I suppose, what else were your feelings going into the actual operation based on not just the hearing aspect of it, but the physical operation?
I think that's a really great question. So many people, they don't talk about the part where they leave the hospital room. For me, in my case, it was leaving the hospital room and going down to the operating room. Um, One of the things I asked my surgeon, please, 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 can I have my hearing aid on at all times? And I know it's going to whistle because you're going to get my head into a certain position and it's going to be uncomfortable, but I need to just poke it in, just do this, just do that, and just please, please keep it in because if I don't have it in, I feel lost. And she said, absolutely. So I remember just going down in actually, yeah, I remember going down the hallway and the surgeon was with me. In fact, she spoke to me before we left the room and she said, I'm just coming in here for 5 minutes, no, 2 seconds. I have to go to the OR, but to get ready for you. But she says, it's going to be okay. It's going to be okay. And she says, and she says, is there any music that you would like to hear? I
Wow.
said, how about you pick what you want to hear? And she says, awesome. She says, I'll pick my favorite music and she says, and we'll just enjoy our time together. And so when I went into the operating room, there was a lot of questions. It was a lot of, what's your name? What's your date of birth? And, what year do you want? And it's this one, and they're checking every piece of documentation that you've signed. These are decisions that you've made. And I loved the warm blanket that I got. And being able to communicate and hear and understand what everybody was saying to me. I was so afraid of being off the air. And my surgeon was just, she didn't even think of talking about it with me, but she said, this is what I do with all my patients. And I can't imagine being turned off but don't worry, Ken, we've got you. I was asking all kinds of questions in the operating room when the anesthesiologist came in. And I said to him, I asked him, I said, so how long will it take? And he says, well, he says, you should be falling asleep just about. And then that was it.
Okay.
And I woke up. It was like I went to sleep and had a nice solid sleep with no dreams and woke up and my hearing aid was in there. And I was so happy to have my hearing aid in there. And I wasn't really expecting to be able to hear anything on the side that was operated on. As I mentioned, I had some low frequency hearing, so I could hear myself swallow and, sniffle because that sound is so low in frequency and it's so amplified when it's covered up like it is when you finish surgery.
Yes.
And I could hear on that side. And I was, no way, this is cool. Like it sounded exactly the way it did
Wow.
going into surgery. And I kept, rubbing the Band-Aid and, thunk, 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 and I could hear. And I was in shock about that because I was very, very prepared to say, this is it, you know? And, so the surgeon comes in, the nurses come in. I said, I can still hear on that side. And she said, yeah, okay. You never know. She doesn't want to promise anything,
Absolutely.
but yeah. So I was thrilled about that. And when you fast forward 6 or 7 months, that's when the hearing starts to change because the act of the operation and the healing process and the chemicals that went in there, the medications, uh, whatever chemicals they may be,
Yes.
they you lose your hearing slowly over time.
Okay.
And but it only dropped about 10 to 20 dB, but I could still hear if it was loud enough. And that was good enough for me. That was a bonus. That was the cherry on the whipping cream of the banana split sundae.
Yes. Yes.
Wow. Because the combination of what I could hear naturally and the cochlear implant was divine.
Wow.
Just divine. So when people are thinking about getting a hybrid implant,
Mhm.
hey, you know, you're gonna love the sound of that.
Yes.
But one of the things, and people did ask me, why didn't you get a hybrid implant? Well, I was afraid that, if I get a hybrid and I only partially implant the electrode
Mhm.
and I don't cover as much of the region as I wanted to, which is the low frequencies too, then I would regret it.
Okay.
And I'm so glad that I went with the full array and full insertion. And I came out and came into the hospital room, and I called my parents. They wanted to make sure that I was okay, and I could call them because I could hear with the hearing aid, and they were thrilled. And then a couple of hours later, it was like, "Hey, let's go get something to eat." Like, it was just really, really easy to recover from. I think the first day was easier than the second day. The second day, I was wiped out. I was super, super tired. And, when you're a private patient in Germany at the particular hospital that I was at, because not every hospital does this. They wanted to keep me for 5 days, and I loved that. Um, I really, really loved it. I don't like staying in a hospital. It's boring. What are you gonna do there? But every little aching pain, every little hiccup that I made, every little gurgling, lots of things come up, little things like swallowing a little bit of blood. And because that's the ear draining the blood from the middle ear cavity, and it's completely normal. It's not a lot, but,
Yes.
you know,
Yes, yes, yes.
it wasn't painful, but it was just, should I be, should I be swallowing that? Ding, 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 ding. Is this normal? Yeah, yeah. All is okay. You know? And then I had a headache. It was so the pressure of the Band-Aid was so tight, and that headache kind of bugged me. Um, but it took me time to get out of the anesthesia.
Mhm. Groggy.
You know,
Yeah.
yeah, yeah, and I was very spoiled within the 5 days. Every single morning, we had an appointment with the surgeon or the resident or whoever was on call to
Mhm.
see patients on the floor. And it was nice because I could sit with other CI patients who had had surgery. And this is a hospital that does a lot of surgery. This is just not like a one surgery a day. They do quite a few because the hospital is back out there. One half of the floors were devoted to ophthalmology, eyes, and the other half was just ENT.
Wow.
And so there was a lot of operation going on, and people are just sitting there and they're just waiting. And then we got to share our stories. And I cannot, that in itself was such a gift, being able to sit with other people who had the same surgery as you did. And then you go, "What's your story? What's your story? What are you doing?" And there are some people who are being explanted and reimplanted because they had pain. And I was very aware of these stories, like, because this is what happens on my caseload too.
Right.
So I don't know. I think, everybody agrees that, parent, parent, teen, teen, kid, kid contact is so um essential. It's a need. And that was the opportunity that I would have gladly paid for, and I did, you know. Um and then I was able to leave on day 5, and I was happy to stay. 5 days.
I love
Okay, call me a princess. Call me a call me a princess. But I really, really appreciated it because I wasn't stressed
Yeah.
at all. There were so many things that really stressed me out, but it was resolved in 5 minutes,
Mm.
and I could recover. And then I went home to my husband's family in Berlin, and it was great because they didn't know what to expect. They weren't, constantly hovering over me like my parents would have. Are you okay? Do you hear anything? What do you think? What do you think of that? You know, I just, they were easygoing. Oh, yeah, nice. It's looking good. Nice to catch up with you. And, and then a month later was the activation.
Okay.
And so what was the activation like for you? I want you to go first, Bianca.
Well, I wanna kind of touch on something that you've just really shared about as far as your story and having that connection with all those other patients who were sort of
Yeah.
going through a similar journey. Because as we spoke about last time, we had those parents who came to the hospital, which was so amazing. And ours is a little bit different, as I would have loved 5 days in the hospital because of everything that you just said. Every little thing, every little symptom, I would have wanted to query. I would have wanted to ask. So we were released 2 hours after his surgery. Because we were in the middle of COVID, the surgeon didn't want us staying in the pediatric ward in case whatever was coming in. So
Yeah.
I recall just sort of kind of quickly getting the call. We were at the hospital already, so I just ran inside. And as I came into post-op, he was laying there with it. His face was so swollen from that compression bandage and everything they'd done.
Yeah.
And he was just looking, no stress, there were no tears. And we went back to the pediatric ward, and they basically said as soon as he'd fed, and had a wet diaper, a wet nappy, we could go home, which he did on demand, and off we went. So we stayed close to the hospital. That was the Saturday evening. And then were given antibiotics, and we couldn't get them in him. Everything we tried. So that was my first panic. We're trying to get the antibiotics in, and he is just spitting. I mean, we just couldn't do it. So we phoned and throwing up as soon as it got into his stomach. So we phoned the surgeon. I think it was like 11 o'clock at night. And she said, okay, I'm going to call in another brand of antibiotics. And then there was a 24-hour pharmacy, and my husband went out, quickly got it, and we got that in him. And then that compression bandage, I remember so well because I don't know, how long did you have yours on for?
Mine was on for at least 2 days.
Okay.
At least 2 days. Like, they really wanted everything to be tight and
Yeah.
compressed.
Yeah.
In fact, with my second surgery on the same year,
Mhm.
more to come on that,
Mhm.
but it was super, super tight, and it was giving me a headache.
Yeah.
And I was just like, "Can you just loosen the bandage a little bit?" And they're like, "999."
I know exactly.
Like, come on. They're like, we can give you Tylenol.
Yeah, exactly, and that's it. So, and I don't know if Ali had a headache because he was 6 months old, so he couldn't tell us that. The first night was a bit rough, and we stuck to the schedule. We woke him up every 4 hours and gave him pain medicine and all that. And we have photos of the next morning where we were staying in my mom's friend's apartment, and we've got all these pillows around him because all you're now concerned about is him falling over. He just learned to sit before this, about 2 months before the surgery, and he was sort of already moving and attempting to crawl. So we were just packing pillows everywhere in case he would fall over because his balance was definitely somewhat thrown off. And after the compression bandage came off, his balance was fine. So I think the head wrap or the compression bandage was more of the cause of his, I don't know, because he was much
It does.
afterwards. Yeah,
It
yeah,
does feel it does feel heavy, and you kind of feel lopsided, and it's more the anesthesia than anything. Like, it just comes and goes, and like I'm saying, like the minute you come out of surgery, you feel great, and you're like, I went to the cafeteria to
yeah.
eat
Mhm.
because I was so hungry, and that required walking outside of the building, right? But the second and the third and the fourth day, no, no, no. And it's just my body. It just
Mhm.
takes time to get this stuff out of out of me.
Absolutely.
And it it's just like I don't want to like babies bounce back from a lot of things, and what you're describing there, I saw that I had babies on my foot as well. They were on the other side.
Okay.
And but I could see them, and them bouncing around, jumping up and down on the bed, and
Yes.
when my surgeon was with me, and she's like, "Yeah, the little ones bounce back so fast, don't they?" And I, you're not kidding.
Yes.
But it's just, but I see it all the time on social media, Bianca. Like babies and children are being released
Mhm.
from the hospital, and there's so many things going wrong. Like sometimes the stitches might, swell up, and bleeding might happen, and you know, um, up, what comes in, what goes out.
Correct.
There's very specific instructions about how um to go to the ladies' room
Yes.
and to the men's room or the whatever. And don't push too hard, don't strain, make sure you've got lots of fiber. And it's true because you've somebody's been in there and it just feels swollen and inflamed, and you feel that. But if you lift anything,
Any
you
strain?
really have to be careful. Yeah. And I don't know, I just feel badly for parents. I mean, I understand hospitals needing to discharge, and
Mhm.
it it isn't easy surgery to get over. It wasn't hard, but there's so many things going on around here that look normal, but there's a wide range of normal. And parents are putting, you know, photos of their child's post-surgical workup. And, they're like, should I go to the doctor? Should I call the doctor? And I'm just like, really?
Yeah. No.
And they can't ask because it's, money.
Absolutely. And I think that is so valid. And I do, again, our community, our surgeon was phenomenal. I mean, we had her cell phone number. As I said, we phoned her that evening at 11. On the Monday morning, so Saturday evening, we left the hospital. Monday morning, we saw her and she took the compression bandage off. And that was, again, something that I wasn't entirely prepared for. I was like, oh, it's just a bandage you take off. But they actually had to like push on his forehead to cut that bandage loose because it was so tight. And I remember that scream quite well. He was not very happy about that. And of course we're holding him down as she's doing this. So it's not, as a mom as well, you've never manhandled your child like that, so
I know.
You weren't used to that kind of, but after that compression bandage came off, I mean, the swelling, it was amazing how he really did bounce back very quickly. And then we got to see for the first time, which something as I wasn't the recipient, I was just the mom, but you could actually see these implants in his head. And you kind of get a fright the first time because he's still so little. And here you have is his head going to look like that forever? Because they've got these big implants sticking out on the sides, which today you can't even see them because he's grown up and his head shape has changed and all of that. Yeah. But it was such a like, whoa. And the pen drawings that they do for placement and all of that, like you see, yeah, you see,
Yeah.
so it was something that I remember the surgeon telling us, you're going to see the marker. Don't get a fright. I did write on him. So she prepared us for all of that. And I know on on a lot of social media stuff, parents often then, when they see it for the first time, say, but they're not symmetrical. They don't look like they're in the same place. And I obviously asked this question and was told, well, often it's not because of the anatomy. So Ollie's is
Yeah.
quite symmetrical. It's pretty perfect, I would say. Um, and but it's a very strange. uh, I remember having a few tears about the fact that his head would never look the same, which again, it's such a silly thing, but your baby is born and your baby's so perfect, and now I'm gonna go put you under this long surgery and you're gonna come out and your head shape is different, which is so trivial. I completely understand that, but it is a feeling I kind of went through, of oh, your head is different now. You're not the same way you were when you were born in that first moment when I held you. So yeah, but that's
That is, I never thought of that. I mean, I have adult clients who have had surgical scars
Mhm.
that, the ones that go like this, and
Yes, yes,
um, everybody has different, and it's quite long, quite
mhm,
deep, and the same on both sides. And he had a very thick scar about this wide, and there's no hair. So if he cuts his hair short, you can see the scar.
mhm,
It bothers him so much. In fact, when he had his first session with me, all he wanted to talk about was whether he could get a hair transplant on the scar. And, would his surgeon allow it? And I said, I don't know. I'm not a surgeon. You can ask. But it bothered him so much. And it would bother me too if I was a guy and I had short hair. Um, it doesn't, it's interesting you mention that because I think there is an element of going through a grieving process.
mhm,
It's nothing to apologize for. Absolutely nothing to feel badly about. You've got a baby and your baby's going in somewhere and they're coming out and they're looking different. And you wonder how that's going to impact the future. You wonder, and it's a valid concern because I do have some sensitivity where the magnet is.
mhm.
And I think that's just my body. Not everybody has this, but I um I have difficulty equalizing pressure in my ears.
Okay.
And so I'm more sensitive where the scar tissue is
Mhm.
and where the operation has taken out some of that bone to
Yeah.
get the electrode in there. And I'm more sensitive. I don't like people putting pressure on it.
Mhm.
And the only thing that gets rid of that discomfort is when I have a real intense, and I don't mean intense in like it, no. I go to an osteopath and a kinesiologist who does sacrocranial therapy, and he's so gentle,
Yes.
gentle, and he just releases, puts my head back on its proper axis and gets the bones connecting properly. I have no idea what he's talking about. But I'm telling you, when he's done,
Mhm.
my ears feel full. They feel normal. That I can put as much pressure on it, and it doesn't bother me. And I just and my bite is different.
Yes. Yeah.
My bite is, nice and solid and where it's supposed to be.
Yes.
And but this is just me. This is just me. This is what I do, and it's a lifesaver for me because this discomfort. It was either bug my surgeon all the time and get tubes, which you don't want to get
Yes.
when you have an implant. Um, and when I found my osteopath, I was in tears. I was so grateful because I know, okay, well, if it starts getting tight or it feels plugged, I'm not going to worry about it because I know I can get relief.
Yes.
So my life goes on as is. Like, I don't have to be, okay, it's just temporary. I'll have an appointment and boom, boom. And he gives me a lot of exercises, to do. But, um, yeah, it's just, I have psoriasis on my scar. So when you have psoriasis, when you get a scar, it becomes psoriasis.
Mhm.
So it's like, it's itchy, and I try to keep that part of the skin, well looked after, but it's hard. So these are changes that come with the price of, wanting to hear better. But I'm telling you, oh, if knowing if I would have known what I know now back then,
Mhm.
uh, would you do it again? Would you do it again? If you were in the same situation, you were pre-implant and you knew you had to go through this to your
Yeah.
hands down.
Yeah. 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 And I,
Like it's so much easier to hear with the implant. Before it was so much struggle, and now it's like, again, the body language, right? Like it's like, oh
exactly.
God. And I never thought I would ever get to that point.
Yes.
Never.
And amazing. And so those finer little things like the scars, like the discomfort, it's all worth it in the end. And in Ollie's case, he doesn't have this scar, but he does have the scar above his ear. So it's funny that you mentioned this because I have mentioned this recently because he wants his hair a little bit shorter, and there is a little bit of a we're gonna see the scars now when he cuts his hair shorter, and it doesn't bother him in the slightest. I think it's obviously a bit of a whatever. If I'm still reacting to it, I haven't completely gotten over it because there was a lot of trauma involved in all of this because as you said, the grief was I never thought we were going to be going through this journey with my child. And that is not a good or a bad thing. It just is what it is. And the reason I said I wish we could have stayed in hospital was so the Monday the compression stock bandage came off, and then we went back to Hopefield, which is 2 hours from the surgeon. Because she said he looks great, no worries. I'll see you again in a week. So we were supposed to see her the following Monday. That Thursday, sorry, and at this point, no blood had come out of his ears like we'd been warned, or his nose, or his mouth. He was just great. The only thing that she did caution was because it's a cochlear implant, there's a increased risk of meningitis. So any new parent doesn't want to hear anything about meningitis, but anyway, she has to tell us what
Did you have the vaccine before?
yeah, we did. Yeah.
Okay.
So we're still told, that you need to it's the worst case scenario, ultimately, is what it is. You also sign that so that Thursday evening around 12 o'clock, he woke up for a feed and he was shivering. He was like ice cold, like a opposite. And I was like, what is going on? So I phoned my mom to come from her house and he's now almost inconsolable. He's starting to cry. And my mom walks in and she takes him from me because I've now phoned the surgeon. I think we phoned her at 1 o'clock in the morning. And she said, pack your stuff and come back right now. So my husband's packing. I'm helping him pack. My mom's holding Ollie. And all of a sudden, he just vomits. And it's just blood and it's all this gunk. And now, in hindsight, I realized he was getting rid of everything that was obviously draining. But in that moment, she says, as long as he's not throwing up, I'm sure it's fine. So he's now thrown up. So we're like, we got to get to the hospital now.
Yeah.
We drive all the way through. But now it's COVID. So at first, they won't let us in the hospital because we haven't had a COVID test. And we're saying we've just had surgery. We haven't been in contact with anyone outside who hasn't been tested. And the surgeon's asking them, please let them in. So anyway, we get in. And long story short, but he had his blood tested and then he slipped for a good 4 hours and he was completely fine. So it was really just that vomiting up all of that stuff. Me having a complete panic attack, and my husband as well. But had we been in the hospital a little bit longer, it would have been. It's not a good or bad thing because you want to get out of the hospital too. But I understand how you say you were a princess. I could understand the princess treatment of any little thing that was going wrong, being able to question that. So I think the fact that our surgeon was our surgeon and that she would allow us to phone at any time of day and ask questions like that. So
That's amazing.
yes.
I would have felt a whole lot better if I would have had my surgeon on speed dial, but she said I have a life. No, she didn't say that. She just she's got other patients to see, right? And I knew that, but it's just every little thing. It was nice to have that comfort. It really was. And yeah, the swallowing of the blood. And if you swallow a lot of it, it makes you feel sick and nauseous and you shaky. Yeah. I could just bring back memories when you talk about that. And but then, you hear stories of other people getting implants and they're like, yeah, I went back to work the next day and it was just aces. And I'm just like, and that's really good for you. Like, it's like with anything in life, if you're pregnancy even, like I was sick the entire time.
Absolutely.
And there are other women who are just, oh, I love being pregnant, and they glow, and I was not one of those. And happy for them and happy for
Absolutely. Yeah.
but yeah, it's really hard because for a surgeon, they want to be there for us. They really, really do. But it's the hospital system, it's the administration. They're demanding everybody to be
Correct.
out.
And I do
Got
think
other patients to see.
exactly. Again, our situation was so different being in COVID. So there was so much unknown from the medical profession. They were trying to do everything the best that they could, and I think they really did.
Yeah.
Because they had no idea at that point. That was May 2020. So that's only 3 months into COVID. At that point, we had no idea what was happening. So I think it's such a different story when you were able to hear, because of course you had your hearing aid and then the amazing residual hearing in the ear. We noticed very much with Ollie the difference in him in that month between his operation and then of course the activation of the switch on, because he didn't have his hearing aids on. So he didn't have access to sound in that month, which was we still continued to talk. At this point we'd started ABT as well. So you do the same thing as what you've always done, but it's different. And then you have moments of like, did he hear that? Like you still have those moments, even though it's impossible because he's not wearing his or he is.
Or
You tell?
maybe not. Like,
Yeah. No, so I firmly believe it sounds not but he has to hear in a different way. He hears in a different way to us. That is whatever that is, but he does definitely in that moment without his technology on his side, he was still hearing and communicating and speaking with us. And yes, we did use some sign at that point too, but it was more than that. You know, when we spoke about that in the first episode about the idea of when he, well, no, sorry, the second one about having his hearing aids switched on for the first time, and how all of a sudden he wasn't looking through us anymore, but he was sort of just looking at us. And you used a beautiful word, said he was seeing us and listening to us in a whole new dimension, and that
Yeah.
didn't go away in that month that he didn't have access to sound. That was still there, you know. It was like it was different, but it was still there. And is it the 3 months, what, 4 months of ADT we'd done before that, and all the extra time? And you know, Mom, both Daniel and I were at home the whole time during this. He had us at his beck and call 24 hours a day. So there was a lot of, but it was interesting. He's never tensed up as much as he did before he got his hearing aids, even in that month without access to sound. So Mom and Dad were quite tense in that period because we also had a major insurance fights. Our bilateral cochlear implantation was approved. He went for it. And then they let us know when they needed to pay we've got a private company that sources cochlear into South Africa. They weren't going to pay them because it hadn't been approved. And we're like, well, it's too late now. He's got the cochlear implants, you know, in him. And it was COVID, and they don't keep stock here. So all the activation kits have to be sent from England. There were only one flight a week from England to South Africa. And yeah, eventually we actually got the money together. As you know, a large amount of money from my mom, and we paid them so that we could get the devices. Eventually the medical aid came through and did it all, but my mom had a courier company help to try and get, as soon as the plane landed in Joburg, to get them to us right away in Cape Town. And so the switch on was delayed by about a week, or activation was delayed about a week because of all that stuff that was still going on in the background.
I it really touches me. That story really touches me in such a deep and profound way because I heard my parents, I've heard so many parents, but grandparents, but especially, I've had grandparents say to me, they look at their child in wonder. They're in a therapy session with me, and you know, they're going through the cochlear implant process, and they're trying to get candidacy, and they see that their grandchild is not, you know, not responding to certain sounds that they can hear. And the thing that comes out of their mouth is, if I could only give him my ears. And every time I hear that, I start bursting out into tears. And it's, and some people may find offense with that because there's nothing wrong with my child's ear.
Yeah.
Not about that. It's just,
Yes, yeah.
no, it's about, you want to have your child experience this, the world of sound that you're fully immersed in, you're bathed in. And it's hard, for grandparents and for parents, and they want so much the best for their children. My mom used to ask me, Karen, do you hate me for making you deaf? And I said, well, first of all, you didn't make me deaf. It was the way I was born. It was the way I'm supposed to be here. And I don't know any differently. I just like the way I hear right now and keep these things on.
Yes.
Like, I remember telling her that, and she was just, and that's such a, it's a hard question to ask for a parent to ask a child, but that's what parents go through. And and that, I understand that. And it's just like, hey, hey, look, I'm grateful that you went through this. Your grandparents, putting together their financial resources to make something happen for you. And it's incredible what parents go through.
And I think, two things on that is one that we still don't know the cause of Ollie's hearing loss, which and we never will, and that's fine. We did have Connexin 26 tested in South Africa at the time of the surgery and CMV as well, and all of those came back inconclusive and negative, so which is great. But I remember very much being like, was it because I was so hard-headed and wanted a natural birth and labored so long in the middle of labor? Did I damage his ear? I went through everything, every possible antenatal vitamins. I was really sick between this week and this week. I was on progesterone at some point. And you absolutely go through that, is it my fault thing. But and then you look at him today, and I truly, my belief system is that, he's here to do the journey that he's also supposed to do. And I can see that. Would I want him to? I can't even imagine him without his cochlear implants. And again, my husband and I often, we'll look at kids' photos of babies, like toddlers between 6 months, 12 months. And then you're like, where's their cochlear implants? But not every single child is deaf just because your child is, but there's something missing. The
Yeah.
he had this bald head until about 14 months old. And the Ubuntu part of my mother she was amazing. My mom was from from the diagnosis where we spoke about in episode 1. They were 2 hours away. It was 8 o'clock at night when we left the hearing center. And I phoned her, and she and my stepdad packed up their stuff and they drove through. And they stayed with us, and she went to almost every single appointment until the surgery. Every single audiology, every single meeting, our AVT, the chat team, Carl DeToy, she was there for all of those appointments. And yeah, today, I don't know what. So I always say,
Wow.
and her and Ollie have such an amazing bond, and I really think that they were there for us for those first 2 years of life.
Yeah.
For him, that was just incredible. Yeah.
I'm yeah. I know what my mom went through, and I see what parents go through, and I'm just in awe. And whenever my mom or my dad were in the hospital, I was there like they were for me. And I think I was there too much because I was probably getting on the nerves of the doctors and the nurses. I think they were more concerned about making sure that I was looking after myself, because caregivers often don't look after themselves, and we should talk about that too.
Yes.
But you know, they asked me, like, you don't have to stay here. You can go home. And I said, I can't. You don't understand. I can't, because my parents did this for me. I am deaf. I have I can't hear anything without my hearing technology. And my parents back in the 70s got me to where I am right now. And you don't know how much it took for them to get me to where I am. And I need to give back to them, you know? And it's just, I was there, and they were just, okay. You're okay. Your parents, you've done a lot for them. And I said, I know, but I need to do it. And I think a lot of parents, I can understand why they would feel a little bit Oh, it's my fault. It's all my this, all my that. You know what? We don't know any differently, number one. We are so happy because you spend a lot of time playing with us,
Yes.
hugging us, loving us, and doing everything. We know what you're doing, but we often don't remember. And I always and the more it's just I
It's
don't know.
it's what you know, and I think that was the best thing that anyone could ever say to me at that time. Yes, it was still very at the initial diagnosis and in those first before the implants, I would almost say, he doesn't know any different. This is his normal. And so all we're gonna do is make it more colorful. I mean, as you once he got those cochlear implants and we'll talk all about I think the activation and the way forward next time, but we really got to he never fought having to wear them, you know. I know that we would be this would be a totally different journey, a totally different story if we had a child who didn't want to wear them, but that wasn't the case. Um,
Yeah.
and so, yes, this is his new normal, and he hears however he hears, because I don't know actually how he hears, but he, he, yeah, it's incredible. And I think, thank you for saying that again. And I think it's something that new parents really have to hear again is that this is what you know, and you are so grateful for all that is done as well. Um,
Yeah. We It's good. It's really, really good. And I can't we're okay if you're okay,
yes. And I
you
think
know?
my mom was trying to reiterate to us the whole time because she was, like you just said, she was very concerned about me the whole time because
Yeah.
I was, you know, that evening after we got the diagnosis and the next morning when we went back for a ABR, I was so tense that he wouldn't actually fall asleep. So my mom actually, she sat with him. She sat and she did the first ABR after the diagnosis to confirm it. So I have photos, and the photos are so funny because they are very blurry, and that's a very beautiful, apt, real life, realistic way of how I felt in that moment. So it's a blurry photo of my mom holding Ollie while he's got all his ABR wires on him, and that's how that moment was. And she said to me then as well, take photos, you have to remember how far you've come. Right now this feels gut-wrenching, but look at where we are 5 years later. It's incredible. So yeah, so funny story, but when I was pregnant with Ollie, I bounced on a ball, you know, those big yoga balls, the entire pregnancy.
Mhm.
It was the only thing that really helped my hips feel great. And in hindsight, knowing now that he couldn't hear, is he never reacted to like when I watch loud noises. You know, I've often seen other friends who are pregnant, and if there's a loud noise, the baby inside their tummy will jump, or they will, you know, they can actually, I don't know what they've described, if it's the mom getting a fright and the baby getting a fright, but Ollie would stay consistent or making them listen to music with head, you know, whatever it is. We didn't do any of that, but and Ollie never really reacted to anything like that. But bouncing on the ball was his favorite thing. If I used to sit and bounce on the ball, he would just start to relax. So when I had him, the only thing that would put him to sleep for the first 2 years of his life was getting on the yoga ball and sitting there and bouncing like this, and he would go to sleep. And it's so funny because today, even if he's upset, then he'll say he wants to sit on my lap while I sit on the ball. And he has his own little toy. And I often think of that for me as confirmation that, you know, his hearing loss happened in utero. It wasn't necessarily because I did go through the birth thing a lot, thinking it was the birth, which I know it wasn't. But he did also receive antibiotics right after birth, and it was an ototoxic antibiotic. Um, but it was one dose, and he was 41 weeks and 6 days already when he was born. So it wasn't a anyway, it doesn't matter. But for me, that comforts me that we have he loved that movement already, and he's craved that sensory input like that. And he's a proprioception child today still, more than anything else. So it was, yeah, don't know why I thought of that. That was my mom sat on the ball that day and put him to sleep for his second ADR to confirm his diagnosis. Yeah.
That's called being responsive to your child.
Yeah.
Being responsive, being looking and observing and thinking about those moments, those things that you're doing that is causing the child or helping the child to react in a certain behavior or to, you know, um, we always want to heighten that parent responsiveness as part of the therapy. In what way? When you have a diagnosis of being deaf or any type of degree, unilateral, um, bilateral, any type of hearing difference, parents think the logical thing, which is my child is not getting any benefit from any auditory input. So what do?
Stop talking.
They stop talking. And I don't blame them. Like that makes logical sense to me. And you know, this is where we have to get back into, and this is why it's so important to get to parents. Oh gosh, I sound like I'm talking like a cult leader.
No, no,
And I'm
no, not at all.
but
No. Yes.
if parents want their children to benefit from hearing technology and to learn to listen and talk, we need to get to them as quickly as possible so that we can let parents understand that we have to continue that input that you think your child is not getting, because it does it does make a difference. It does. And so my takeaway from this episode is what you said again, is when Ollie got his hearing aids, and it couldn't have been that much that he could hear
Yes.
with the implant, but with the hearing aid, but he heard something.
Yes.
And that was a sensory input that he could grab and hold on to and help him connect. And we're talking so much about connection in our episodes. And, people connect with their children in different ways. And, they use visual, they use tactile. Ollie really liked the bouncing. That's being responsive. That's giving him more. He liked it. You bounced. He liked it, then you give them more. You respond as a parent to this. And so I just was looking through a book, a chapter that I co-wrote on coaching parents and caregivers in auditory verbal therapy. And there was a quote that I loved so much that Doreen Pollock, one of the pioneers of ABT, auditory verbal therapy, basically said, she said, Doreen Pollock, pioneer of ABT, urged practitioners to coach parents in creating the right learning environment, one in which their child who is deaf or hard of hearing could be bathed in sound, surrounded by people. I'd like to add people who the baby loves
Yes.
and who loves the baby, but surrounded by loved ones who believe he, she, or they could hear and expect the child to listen and respond in the relevant and meaningful context of daily experiences. And yes, I know, there are some times when the baby can't hear enough. So if listening in spoken language is a desired outcome, we need to get the hearing piece, sorted out.
Yeah.
And we do that with hearing aids. We do that with cochlear implants. We might do that with auditory brainstem implants. Um, and and once we get that hearing technology, even before we get that hearing technology, because we have to get the parents believing again, we need to grab onto that hope, right? And so this is another quote by Silverman. And these pioneers are back in the 60s, which is so incredible, so forward thinking. They said we recognizing that sound education for the child who is deaf or hard of hearing is as much an attitude as it is an atmosphere. So you have to, when you invest your time and your energy as parents, your financial resources, or that of the insurance company, well, it's your financial resources, right?
Correct. Yeah.
You you really have to change your attitude about from a child who can't hear to a child who can and will hear.
Mhm.
And unless it gets to the point where, there's really nothing we can do. And then at this point, we have to find an alternative way to connect and to communicate with the world. And and it's just as beautiful, you know. But I really loved this quote.
Yes.
And I think this is what, if you want listening in spoken language for your child, then it's about getting an attitude adjustment. And I know now that I'm grown up and I'm a professional and I've seen lots of parents, I know how hard it is.
Yeah.
To grab onto that. It's so hard. But if you can, then it's better for us. And this is a lifelong thing, and you have to instill this love, this attitude, this responsibility in the children that we work with, because eventually they're going to have to look after their own hearing
Yes, this is true.
independently.
Yeah.
Yeah.
Well, and I think that's such a lovely full circle ending to today's episode about we started with body language and you summed it up so beautifully in the sense that it is all about connection, and connection may not look exactly, it's not just about the spoken word as well, but it's also about looking holistically at how your child is experiencing life with or without hearing technology. Yeah. Thank you very much. And I look forward to chatting about our activation experiences in the next episode.
Yeah. I'll see you soon.
So that's it for today's episode of Ubuntu Hearing, Communication, Language, and Connection. Thanks for spending time with us.
We hope our conversation sparked new ideas and gave you some comfort or simply made you feel connected.
We'd love to hear your story. Reach out, share your experiences, and keep the conversation going.
Remember, we're just sharing our perspectives and our respective journeys. There's no right or wrong path, only the one that's right for you.
Until next time, take care and stay curious.